Yes, hello everyone. This is Dr. Khan, Executive Plastic Surgery, Bloomfield, Michigan. So I've just done a total capsulectomy on a nice patient, 70 years of age. She had implants from 2005, saline implants. Back in '05, you could get saline implants unless you were part of an experimental study, and then you could get silicone then below the muscle. And so she came with a lot of symptoms of what is suggestive of what is breast implant illness. So on the right side, as you will see, she got 100% total capsulectomy, 7/23/25, initials MH. I got my sterile gloves here, and you will see there's some proline suture that I removed that was tightly adherent to the periosteum and anchoring this in, as you can see right here. So all of this foreign material was removed. There was some inflamed tissue at the bottom that I removed as well, that was sitting at the level of the inframammary crease. And so I removed the entire implant and the capsule, and I'm very happy and content with how the whole dissection has gone. And some inflamed tissue that I removed along with the capsule. And as you can see, there's a lot of inflammation that was noted despite what are these saline implants. So as you can see, this tissue is not healthy, and I removed it. You can see the quality of this tissue and the fatty tissue that I removed. So this is good, healthy fatty tissue for contouring purposes that I removed, and you can see this is inflamed tissue. So as I go in, we know these are saline implants that cannot be ruptured. And so as you will see right here, so there's some fluid around in the back. And I just want to show, this is like the purpose of showing this. So if I go like this, you can see the stickiness, the sliminess, it's that leaching, if you will. Look at this, there is this, I'm going to take a good representative sample over here. Here's some floaters on the inside, but you can see there's a discoloration over here. So I'm going to get some cultures on the inside over here to send off to microbiology lab for aerobic, anaerobic, and fungal. So what is an overfilled 350 cc's Mentor saline implant? You can see the pressure on the sides. And you can see there's what is start of this breakdown of that saline implant. The one thing I want to show here is if you look at this capsular tissue, it is so thin right here. And so this fatty tissue behind, in my practice, I remove that too, so that all of that inflamed burden is removed. And as you will see, look at the quality of this fat. It has like a brown green tinge to it versus this one. And so that's why I remove it. And that spread of that slimy discharge is embedded within this tissue, and that's why it's important to remove it. And you can see my blue glove, how thin the capsule is. Complete total removal. And so I will be sending this capsule off to pathology. And I'm going to send this tissue as well to pathology as well, and I'm going to take cultures. Now I'm going to remove my top sterile glove, and I have a sterile glove underneath on the left side. And as you will see, similarly, I removed some of the tissue for contouring purposes. I removed more tissue on the side. She had what was adhesions, and again, tissue that was abnormal, felt abnormal, palpated abnormal, so I removed it. And overall, I'm very happy and content with how the whole dissection has gone. And I'm going to go ahead and cut this open. And as you will see, a lot of inflammation on the left side as well. So you can see some fluid on the inside. It's all contained. This tissue is very inflamed right here, what I'm holding, and that's why there's some nodularity to it, and that's why I removed it. And you can see the fluid around. So if I go like this, Look at that stickiness. This is what's been leaching into the periphery. 350 Mentor. As you will see, this is intact saline implant. Capsular tissue, as you can see, so thin. You can see my green glove, some areas thick. And all of this inflamed tissue has been removed, such that there is no inflammatory burden left behind. And overall, I'm very happy and content with how the whole dissection has gone. Let me go ahead and see this area. So no masses, nothing. So the implants will be returned to the patient. Capsules to be sent to pathology, rule out the PLLC, LCD30 analysis, rule out lymphoma, rule out malignancy, rule out any abnormal pathology. Cultures for aerobic, anaerobic, and fungal. Only good, healthy, viable tissue remaining behind. Extensive contouring down on the left and also on the right. She had what was an incision through the nipple areola complex, and there was a very significant indentation and adhesion that was cinching the nipple areola inward that was released. And so all of the contouring was done to help with the aesthetic contouring on this nice 70-year-old. And so we'll see how she does post-op minus these toxins. Implants, like I said, will be returned to the patient. Capsule sent to pathology, rule out that rare BIA, ALCL, BIA-SAC, breast cancer, anything. Cultures for aerobic, anaerobic, and fungal. And like I said, we'll see how she does post-op minus these toxins. This is Dr. Khan, Executive Plastic Surgeon.